Hey, and welcome to Your Health Truth with your host, Brock Hardman. Today, we are talking about vitamin D, specifically vitamin D3. There's basically two forms, vitamin D2, vitamin D3, that you're going to find in supplementation form. However, I think most people would agree that vitamin D3 is actually kind of the most beneficial one. So that's the one we're going to talk about today. Vitamin D is basically, there's two ways that normally your body is going to be able to utilize it. The first and probably the best is through the sun. Basically, the sun, what it does is it activates the cholesterol in your skin and converts that into vitamin D in a form that your body can then, help utilize that along with calcium and phosphorus. So a lot of people who are deficient in like calcium, let's say, who are osteoporosis or something like that, they're also deficient in vitamin D because your body cannot utilize calcium without vitamin D. And a lot of people don't know that. They think that if they just, pump a lot of calcium pills, that they're going to get, fix their calcium deficiency. And so if they get out in the sun more or take a vitamin D supplement, it would actually help more. So, if you can't get in the sun, there's a lot of people in the winter months who don't get out much, or people who live, up north or further from the equator, who at times during the year just either don't get out or, there's a lot of cloud cover. That's when you want to take supplementation. So if you can get out in the sun, I would say 10 to 15 minutes a day, that's great. You don't need to take a supplementation. However, on days that you can't get in the sun, or weeks, you don't need supplementation every day, but at least 2 to 3 days a week because it's a fat-soluble vitamin. So it'll store a little bit of vitamin D, but your body utilizes it pretty quick because, like I said, it needs it for calcium and phosphorus and stuff like that to help your body absorb those minerals. So just a good rule of thumb is, during the summer that you're out in the sun, you probably don't need to supplement because you're just going to be wasting it. But times that you're inside for long periods of time, then I would highly recommend a vitamin D supplement. Like I said, it is fat soluble, which is good, and if you get enough sun, you don't need it. Now, vitamin D has been linked to over 100 different illnesses, both chronic and non-chronic, and there's just overwhelming amounts of evidence as to the powerful benefits of vitamin D. It's been linked to not only protection from viruses and boosting your immune system, but also autoimmune diseases such as MS, stuff like that, and Alzheimer's as well. It's been proven to enhance brain function. So people that that are getting old or elderly and that stay inside a lot, that's another thing that they need to supplement is vitamin D because they're inside, and a lot of older people don't get out as much. And so another kind of a side deal is a lot of older people get arthritis as well. So it's kind of a combo deal where vitamin D helps with both. It helps with Alzheimer's, helps with arthritis, and brain function. So vitamin D, it's right up there with vitamin C. It's kind of, or I would say it's probably even higher up on the chart because, one last thing, sorry. Blood sugar. So for people who are diabetic, I would highly recommend vitamin D as well because it helps with regulating blood sugar. Now, what they have proven, this is probably the most sobering statistic, is between 80 and 90% of all cancer patients are deficient in vitamin D. That is a scary statistic, and it's one that should kind of drive my point home that you need to take a vitamin D supplement if you're not getting out in the sun. So, hopefully you can appreciate vitamin D now and know that if you aren't in the sun very often, that you really, really need to take a vitamin D supplement. If you take it along with calcium, that's even better because then your body can absorb the calcium at the same time. And there's a lot of other things that you can kind of mix and match with vitamin D3 or calcium and magnesium. But just know that you really need to have significant levels of vitamin D in your blood to prevent illness. So that's it for today. Thank you.